I'm Molly with Wisco Lactation, and today we're going to be talking about harvesting colostrum prenatally. I am expecting my second little one and have been harvesting colostrum to save in the event that we need it after she's here. Harvesting colostrum just means in your pregnancy, with your provider approval, usually around 37 or so weeks, you're hand expressing and saving the colostrum that you collect to be able to supplement your baby with after delivery. You can use this for, if the baby's gonna be big, if you're concerned about gestational diabetes, having, extra supply just in the event that they need a little bit of help with their blood sugars. There's a plethora of reasons that it can be really helpful, and we at Wisco Lactation can kind of walk you through what might be useful in your specific situation. But let's give you a little tutorial on how to actually hand express.
So first we're going to try to find the sweet spot when harvesting colostrum or hand expressing in general. So usually starting a couple finger widths up from the nipple, placing your thumb, and then a few finger widths down below the nipple with the other two fingers. I'm going to start by just kind of expressing back and then gently rolling my fingers together. You can see, whoop, we got a drip here. Coming back and then kind of rolling my fingers together. The goal here is not to express these big sprays, huge volumes, but just a little bit that we can either supplement baby with, and then I can take a syringe and I can suck it up and store that in the freezer for once this little one makes their arrival. You can also use a small container to collect in instead of a spoon, where you just, again, kind of line your fingers up about 2 finger widths on the top of the nipple and below, pushing in towards my chest wall and squeezing and rolling together. You can see that just a couple beads of colostrum here coming down. I'm being really gentle. I'm not trying to force anything, hurt myself. And again, the goal is not to get huge volumes, but just doing this a couple times a day in your pregnancy at about 37 weeks can just give you a little extra to be able to supplement with after baby's here. So this is just an example. Usually we would try to get a little bit more volume in before we use the syringe to suck it up, but I've got a little bit of colostrum here stored in this container, so then I can just kind of suck up that tiny little bit of volume, save it, and then add to this, so that way when my little one's here, we've got a full milliliter syringe worth of colostrum that we can supplement with as needed.